Go live.
What do you say?
Hey, Dad. Ew.
Good afternoon, everybody, and welcome to the End Summit series. This is day 4 of 4, and we are happy to have everybody here joining us today. Today is in a Christmas-like theme. We're going to put a tidy bow on everything and wrap up all of our presentations and finish off strong with discussions about law and legal issues with tobacco and electronic nicotine delivery systems and other issues. And then after that, we will finish up talking about policy and work in North Dakota. Before we do that, I will start with a quick announcement from Kara Becker from our staff. And she is our tobacco cessation coordinator, and she has just an announcement about evaluation and credits.
Okay. Hi. So as with the other presentations the other days, we will be collecting your feedback. Please consider filling out the evaluation. Your feedback is important to us. Your comments and information helps us decide about future education opportunities and topics. So towards the end of the presentation, please watch the chat feature. I will post a link to our evaluation survey, and it's also through that evaluation link that you'll be able to request continuing education credits. CEUs are available for tobacco treatment specialists, nursing, and North Dakota respiratory therapists. Thanks.
Thank you, Kara. Today we're going to start with 2 presenters from the Public Health Law Center. They work out of St. Paul, Minnesota, and they help programs in states and even contribute to international efforts as well. And they're known across the country as being excellent legal minds when it comes to tobacco prevention and issues affecting the tobacco industry and laws and ordinances. And they've been helping us in North Dakota for quite a while. But one of my favorite things about them is they become personal folk heroes of mine, since they have been speaking freely about the role or lack thereof of a regulation of electronic products, including the FDA. And it really helps have us, somebody support our efforts and talk about how possibly industry language involving how their requirements, the FDA is sending harshly or strongly worded letters to industry businesses that are breaking the law or going against the ordinance, how that might not be enough regulation. And so to start this out, we're going to have 2 gentlemen from the Public Health Law Center. First is Desmond Jenson. Desmond Jenson is a graduate of William Mitchell College of Law, where he received a Cali Award for Public Health Law. He is currently a lead senior staff attorney for federal regulation, commercial tobacco control programs at the Public Health Law Center in St. Paul, Minnesota. Desmond's focus is federal commercial tobacco control policy, primarily the U.S. Food and Drug Administration's regulation of tobacco products. As an administrative law expert, Desmond closely monitors the FDA and other agencies and leads the public health community in identifying opportunities to strengthen federal tobacco regulation. He coordinates with local, state, tribal, national, and global public health leaders keeping them apprised of important regulatory changes and litigation impacting federal tobacco control efforts. Desmond drafts many of the Center's comments to the FDA, helps to coordinate the filing of amicus curiae briefs in important litigation, develops educational filing of educational materials explaining federal law, and speaks to public health audiences like us about tobacco control. Desmond also works closely with scientists, consulting on the development of research as well as writing manuscripts to build an evidence base for legally defensible tobacco control policies. Immediately after Desmond is Mark Meaney. Mark Meaney is the Deputy Director of the Commercial Tobacco Control Program at the Public Health Law Center. Mark leads a team of attorneys and policy analysts working to support tobacco control policy change throughout the United States by providing legal technical assistance to public health professionals and advocates, developing resources on the most effective legal and policy measures to reduce the burden of disease and death caused by tobacco use in the United States, and providing strategic leadership around bold policy options to reduce health disparities by ending the commercial tobacco epidemic. Mark received his master's degree in public policy from the University of Wisconsin-Madison and his law degree from the University of Minnesota Law School. I want to welcome both of the gentlemen from the Public Health Law Center, and we will start with Desmond Jenson, who is from North Dakota, and happy to have you home.
Thanks, Neil. All right, hopefully people can see my slides. Let me know if I need to do anything different on my end. Thanks again. It's always a pleasure to get to speak to folks back home in North Dakota. I haven't been back for a little while because of travel restrictions, but hope to visit again sometime soon. All right. So just a quick note, if you haven't worked with us before, we're a legal resource center that provides free legal technical assistance to members of the public health community who are working on policy issues related to chronic disease. So we divide our work into two teams, one working on commercial tobacco control that Mark and I are on, and then the other one working on healthy eating and active living policy. Everything we do is grounded in health equity. We strive to work with our partners to identify the ways in which to ensure that all of the policies that we work on have the best possible outcomes for all members of the community, and not only don't exacerbate health disparities, but actually work towards correcting them. That work takes the form of legal technical assistance, which includes webinars and trainings. We create hundreds of publications that you can find on our website, but most of what we do is individual legal technical assistance, where we answer individual questions from advocacy organizations, state and local health professionals, and private citizens. We answer the complicated legal questions that are always embedded in policy work. The only two things we don't really do, we don't go to court on anyone's behalf, although we do file what are called amicus curiae briefs, or friend of the court briefs, in important tobacco control litigation, and we don't do any lobbying. So we work directly with lobbyists or advocacy organizations, but we don't engage directly with policymakers in a lobbying capacity. All right, just double checking people can see my slides, right? I'm new to Microsoft Teams. Okay, great. Sorry. You never know. Zoom does weird things to me, and like I said, I don't normally use Teams. So okay. So I'm gonna have a little bit to go through today. I want to start off contextualizing the youth e-cigarette epidemic, particularly the role of JUUL. We'll talk about what the FDA has been up to, and then look ahead to the immediate future as well. And then I'm going to turn things over to Mark, and he can discuss some of the sort of latent state and local e-cigarette policy issues as well. So this probably isn't new for you. E-cigarette use by high school students has been growing consistently for a while. This is data from the National Youth Tobacco Survey from 2011 through 2020. Obviously, we're particularly concerned with the last few years when the numbers have reached epidemic proportions. The numbers this year fell, but only really back to where we were in 2018. And I'm sure you can think of a variety of reasons for that that are completely unrelated to strong regulation. We should also be very concerned with use by middle school students, which, while lower, is following the same trajectory as high school students as well. What I want to try to contextualize in the next few slides is why this is happening, or better question is why it wasn't prevented. And we're going to do that by looking at e-cigarette sales data, which I think is a really good way to sort of understand what's happening. So this is e-cigarette sales data. It's monthly e-cigarette sales in millions of dollars. This is from late 2015, or from early 2015 through late 2019, which gets us to the peak of the youth e-cigarette epidemic. This data is from the Nielsen company, so it's most retailers that sell e-cigarettes. It unfortunately doesn't include vape shops, and it doesn't include online sales, but it's still a pretty good representation of what's happening here in the United States. Each of these colors represents sales of one of the largest e-cigarette manufacturers, and you can see that for these companies, sales have been relatively flat for quite some time. But I've left off JUUL, and essentially all of the growth of the e-cigarette market that's happened in the last 3 years has been JUUL. In fact, when the other companies have had short-term or even steady growth, it's because they've introduced products that mimic the unique features of JUUL. So you can see a little bump for Logic in May of 2018, some growth for Vuse and Enjoy in the middle of 2019, because those companies introduced their own nicotine salt products. So let's connect another dot that's important. This, what I put on the screen now, is the trend of youth e-cigarette use along with the e-cigarette market growth. Obviously different y-axis, but I'm just showing you they're both going in the same direction and kind of at the same rate too. And it should surprise none of us that JUUL's tremendous growth since 2016 has a direct correlation with the increase in youth e-cigarette use. And given what we know about JUUL's marketing tactics and its product innovations, this is, common sense outcome. In 2018, the e-cigarette market sat at about $300 million per month in sales, and there were about 3 million kids buying and using e-cigarettes. If you jump forward a year, it's 4 million kids and it's $400 million in sales per month. So it's actually pretty much a direct correlation. Now, if you haven't seen the information I'm going to show you yet, I'm excited to be the first to show it to you. But a lot of what you're going to see is coming from an MMWR article. It was published by the folks at the CDC Foundation, and the Truth Initiative. And thank you to my friends at those 3 organizations for letting me borrow their charts and recolor them and reshape them a little bit. I would encourage people to go back and read the article in the MMWR. Researchers are always better explaining their work than I can. And they didn't contextualize the information the same way that I do, so it is worth reading. So my favorite chart that they have, we'll start there. So this chart, I think, shows you precisely how the market is changing and why. And we're going to spend a few minutes on it. This is also market data. So we're again looking at e-cigarette sales over time. Now, obviously, we have information on flavors here, but I'm also going to point out that this chart uses unit sales. So it's counting how many devices and cartridges each company is selling. The chart I showed you before had dollar sales. So it counts the value of the goods sold by each company. Now, both of these are totally fine way to measure the market. In fact, if you overlay my dollar chart with the unit chart, you can see the trends are pretty much the same. And if I tweak things a little better, probably could have put them on exactly the same curve. So back to the unit chart. It's worth restating again here that JUUL has such a huge share of the market that when you're talking about the trends of the market as a whole, based on flavor, you can pretty much attribute the macro market changes almost entirely to JUUL. And I'll show you how that plays out in a minute. But first, I'm going to point out a couple of aggregate events, or events that affect aggregate sales, and that'll show you why there's some of these peaks and valleys. So there's a peak in late 2018. We'll talk more about this, but this is JUUL unable to keep up demand after voluntarily removing some of its products from stores, which you may remember. There's another peak in mid-2019. This was early in the EVALI outbreak. EVALI, if you don't recall, is e-cigarette and vaping associated lung injury. You might recall that at the beginning of that epidemic, sales of all vaping products dropped off very quickly because the cause of EVALI was unknown. So that's why there's a clear, sharp decline right there. And then finally, obviously, as EVALI waned, the current pandemic turned the world upside down. So I'm just highlighting these events so you can see that even though sales of e-cigarettes have been in a decline and that youth initiation has decreased, those are mostly temporary circumstances and they are unrelated to regulation. So now we'll turn to looking at flavors in the chart and how that plays out. But so if you're unaware, in the US, JUUL has been marketed in 8 different flavors. So there's mint and menthol, which are different flavors. Then there's creme, cucumber, fruit, mango, and 2 tobacco flavors. And I recolored the MMWR chart to make things a little bit easier for us. So when you put those flavors, those 8 flavors into this chart's categories, this is the breakdown. Menthol and mint obviously each have their own category. Creme, cucumber, fruit, and mango all fall into this chart's all other flavors category. And if you don't know, mango was JUUL's most popular flavor for a very long time. And most of the sales in this chart, even though it's all companies, most of the sales in the all other flavors category are JUUL's mango pods. And then JUUL has 2 tobacco flavors. They go into the tobacco category. There's a tiny little blue line that sits at the top of each bar. It's an anomaly in the data. The flavor wasn't available. It's small and nothing to worry about there, but just flagging for you that it is there if you squint and look close. You may have sort of picked up the 3 flavors we're going to focus on are menthol, mint, and mango. And the relative position of those flavors over time will tell you everything about who is responsible for the youth e-cigarette epidemic. So now we look at this through the lens of JUUL's business practices. So for most of JUUL's history, from 2015 through late 2018, which is highlighted here, it sold all 8 of its flavors, both at retail and online. Now I've circled for you at the end of that period the proportion of mango, and you can see that it is the absolute dominant flavor. And again, this is all companies, not just JUUL, but most of that percentage is JUUL's mango pods. Now, as I alluded to earlier, as a result of pressure from public health folks, from media scrutiny, there was congressional hearings, the FDA sent a few letters, JUUL decided to pull 4 of its flavors from retail stores and only sell them on its website. And those are the flavors that all fit into the all other flavors category on the chart. Again, creme, cucumber, fruit, and most importantly, mango. Now, as I mentioned before, this actually resulted in a nationwide shortage of JUUL pods. JUUL's supply chain was not prepared for them to pull 4 of their flavors from stores. It's probably a decision that was made without a lot of planning ahead of time. There was not enough pods to go around. So there's a temporary drop in sales that results after that. But as soon as JUUL could ship enough of its mint pods, the market grew again. And at this point, mint becomes the best-selling flavor. Now, not surprisingly, public health advocates pushed back on JUUL and its continued sales of mint and menthol, which are flavors. JUUL reacted by completely discontinuing its sales of all flavors other than menthol and its 2 tobacco flavors until they could be reviewed by the FDA. We'll talk about that process more. Unsurprisingly, menthol became the #1 flavor for the first time. There's a lesson there about exempting flavors from regulation, which is an important thing to talk about as well. So now let's turn to what the FDA has been doing and not doing, and it'll be clear to you, hopefully if it isn't already, that the FDA's actions are reactive, not proactive. JUUL and other companies are adapting, and the FDA is not anticipating their next moves, even though those moves are pretty predictable. In order to really understand the scope of the FDA's failure, you need to understand a little bit about the FDA's authority to regulate e-cigarettes. This probably isn't new, but we'll go through it really quickly. When the Tobacco Control Act passed in 2009, it required the FDA to regulate cigarettes, smokeless tobacco, and roll your own tobacco. For any other product that is made or derived from tobacco and intended for human consumption, cigars, e-cigarettes, water pipe tobacco, the FDA had to actually go through its rulemaking process, which it didn't start until 2014 and it didn't finish until 2016. So that means that until 2016, the FDA could not do anything related to e-cigarettes. Now, you should also know that the FDA's Tobacco Product Authority includes pre-market review of its products, and that looks fairly similar to the FDA's Drug Authority, which I think we're all more familiar with than we were a year ago, right? And in the FDA's Drug Authority and in its Tobacco Authority, manufacturers are not allowed to sell a product at all until after it's been authorized by the FDA. So once e-cigarettes were subject to the FDA's jurisdiction in 2016, The products were actually required to be reviewed by the FDA before they could be sold. Now, that's obviously not how things have been implemented. Ultimately, what the FDA decided was that e-cigarettes could stay on the market for several more years beyond when pre-market review was first required for them, again in 2016. In fact, the FDA's plan was much more lenient than the one I'm showing you here, but luckily public health groups actually sued the FDA and won. And so now, September of this year, manufacturers were required to apply for pre-market review. And then next year, next September, FDA authorization will be required for those products to stay on the market. So since August of 2016, the FDA has actually been using its discretion to allow e-cigarettes to remain on the market, even though they're technically illegal. But that means that at any time, the FDA could have ordered any e-cigarette to be removed from the market and actually forced the manufacturer to apply for pre-market review. So it's an incredibly powerful tool, and the FDA has absolutely squandered it. So just think about it this way. The moment that JUUL was under scrutiny, and I'm sure we all remember the constant news, right? The FDA could have removed all of its products from the market and forced the company to prove that its products meet statutory standards. Obviously, that didn't happen. Instead, the FDA made lots of headlines with a series of actions that really had no real impact on the market. It requested information from JUUL and sent warning letters, but it never ordered the removal of its products, which again, it could have done. So you don't need to read through this entire timeline of selected events because I'm going to highlight two crucial things for you. When the FDA formally proposed action, and then when it formally acted on e-cigarette flavors, which we'll talk more about, each time it retroactively ratified something that JUUL had already voluntarily done. As I mentioned, JUUL voluntarily removed mango and other flavors from stores, but it crucially left mint on the market. Shortly after that, the FDA proposed to take action on flavors, but it proposed to exempt mint from that action. Then again, a little bit later, JUUL voluntarily suspended sales of mint, and at that point, the FDA was fine with including mint within the scope of its action. But JUUL left menthol on the market, and the FDA also exempted that flavor. Now, this isn't to say that JUUL is the good guy. That's not what you should take away. What I want you to see is that when the FDA acted, it was following the industry's lead. And this is not what effective regulation looks like. This is what industry self-regulation looks like. Now, there's a couple more charts from the MMWR article. And in order to make sense of them, we have to dig into a little bit more of the detail of the FDA's action that I wouldn't necessarily otherwise go into, but you kind of have to know the background in order to make sense of the charts. So when the FDA acted on flavors, it made a distinction between cartridge-based e-cigarettes like JUUL and disposable products like Puff Bar, which hopefully people are at least a little familiar with. If you're not, that's fine. What you need to know is that JUUL and products like it, they sell their devices and the cartridges or pods separately. The device is rechargeable, and then you buy additional pre-filled pods to insert in the device, but it's only the pods that are discarded. With the disposable products like Puff Bar, the device and the pod are inseparable, and once the nicotine is used up, the entire unit is discarded, and the user buys an entirely new device that's pre-filled with nicotine. So the devices operate slightly differently, but they're not really used differently by youth or adults. But despite that, the FDA decided to treat them differently. So for JUUL and similar devices, the FDA acted on all flavors except tobacco and menthol. However, for disposable products, the FDA allowed all flavors to remain on the market. Now, before I show you how this plays out, I'm also going to highlight for you that the FDA's action is inherently temporary. Now, because the FDA is using its discretion in enforcing pre-market review, what has actually done is forced JUUL and other companies to remove their products from the market now, but they are free to apply and get permission to market those products again in the future. And it is possible, if not likely, that in the future, the FDA will authorize the sale of flavored e-cigarettes like JUUL. So this action is only effective in the short term. It is entirely possible that JUUL Mango could come back onto the market if the FDA allows it. Okay, so now we turn to the sales charts from the MMWR. There's going to be two separate charts to look at, and we're looking at cartridge-based and disposable products separately. So first we have the cartridge-based products like JUUL. Now instead of total units, what you're looking at is flavors as a percentage of units sold. So this is a better way to show you the ebb and the flow of the popularity of various flavor categories over time. Not surprisingly, when JUUL hit the market back in 2015, its mango flavor took off quickly. Also, JUUL was the only brand selling a mint flavor at that point, so the growth of mint right after that is also JUUL. You can see there's a clear increase in mint and mango. There are corresponding decreases in tobacco and menthol. Everything here should add up to 100%. So an increase in one place results in a decrease the other. Those are due, the growth there is due to JUUL's introduction. You can see steady growth and then exponential growth of mango. Now, as we discussed already, JUUL eventually pulls mango and other flavors, and not surprisingly, sales of that category drop off considerably. But when JUUL is able to ship enough of its mint pods, mint starts to displace mango as the dominant flavor in the market. Again, JUUL pulls mint, that drops off immediately, and again is quickly replaced by menthol. You can see it goes from being the smallest category before that action to the most popular flavor after. Now the FDA's action happens at this point, later, and you can see that it has virtually no change on the trajectory of mint or menthol. Those trends are just continuing after JUUL's action. The only impact you can maybe see here is that the FDA finished off what was left of the all other flavors category. And those would have been products from other brands other than JUUL that had flavors that were not mint, menthol, or tobacco, not a large market segment. And it looks like most of those users switched to menthol. So when it comes to JUUL and other cartridge-based products, the FDA's action just ratifies the status quo, and it was created by JUUL, not by regulation. Now, disposable products. Again, I've highlighted Puff Bar as an example because it became a replacement product for JUUL when it stopped selling mango. I'll also highlight for you that because Puff Bar was new to the market in 2019, by the FDA's own policies, it should have never been legally sold. We'll talk more about this in a minute. It took the FDA until July of this year to warn Puff Bar of its illegal sales. And again, at that point, the company had already ceased distribution in the United States. So here's the flavor trends in the disposable market. It's far less chaotic than the cartridge market, but there's a couple of things to highlight. One important trend is that after JUUL removes mango from the market, you can see a clear increase in the sales of the all other flavors. And this is almost certainly due to the fact that many youth picked up Puff Bar after JUUL pods were harder to acquire and Puff Bar came in the flavors that they liked that JUUL no longer sold. And JUUL's removal of mint doesn't really have that much of an impact on this market because by this point, the all other flavors are dominating and that trend just continues. The FDA's action happens here. There's only one thing you can maybe speculate about here. It looks like the menthol flavor drops off. I would speculate that because menthol was now the only flavor available for the cartridge-based products, the menthol varieties of those products became more popular than the menthol varieties of the disposable products. So if as an example, if an e-cigarette user was going to the store intending to buy menthol, there were more menthol JUUL and Views and other flavors than there were menthol Puff Bar. So they sold a little bit better there. But again, the FDA took no action with respect to the other flavors of the disposable products, and they continue to sell just fine. So hopefully what you take away from this is that the FDA has not been an effective regulator. The FDA could have removed JUUL's products from the market when it realized JUUL had deliberately marketed to youth and been effective in its efforts. And now, despite the failures up to this point, I will say that I think there is some potential for change in the future. So again, the FDA has been forced to implement pre-market review as a result of litigation from public health groups. They attempted initially to defer the review of applications to the end of 2022. The public health groups won that lawsuit. The court hearing that case imposed two important deadlines. Again, on September 9th of this year, manufacturers were supposed to file marketing applications for e-cigarettes, those that entered the market before August 8th of 2016. If a product did not have an application filed on September 9th, it is illegal to sell that product in the United States now. Over the next year, the FDA is going to be reviewing applications and acting on them. And then on September 9th of next year, 2021, any e-cigarettes that have not been authorized by the FDA must be removed from the market until they receive authorization. So there is a strong possibility that we could see the e-cigarette market cleared of some products in the next year. However, I would not count on a sea change for a couple of reasons. First, I would fully expect the FDA to be completely overwhelmed by applications in the short term. According to a statement put out by Mitch Zeller, who's the director of the FDA Center for Tobacco Products, on August 31st. By that date, the FDA had already received applications for 2,000 products, so that's the week before the deadline. But according to the list of products that the FDA maintains, there could be applications for as many as 400 million products. Now, I doubt there's any question that the FDA won't be able to review that volume of applications in 12 months. They have a lot of staff, but not enough for that. There will certainly be products that have not been authorized by September 9th of 2021. And at that point, there must be effective enforcement. And we must see the FDA working to remove illegal products from the market. And there is definitely reason to be skeptical that that enforcement process will go smoothly, as the FDA has been very hesitant to act on products that enter the market illegally. You can simply look back at the FDA's efforts since 2016. So the beginning of the FDA's authority over e-cigarettes was August 8th, 2016. And that was supposed to actually freeze the market. So no new products could be introduced without authorization prior to marketing. Products that were already on the market could stay, but new products can't be sold until after the FDA authorizes them. Now, I'm willing to bet most tobacco control folks can think of at least a few e-cigarettes that came to the market after that date, right? But even if you can't, look at it this way. In August 8th of 2016, JUUL'S market share, as you can see here, was minuscule. At that point, it was still a fairly new product, and it was not outselling the big tobacco companies. So there would be no reason for those companies to emulate JUUL'S success. JUUL had yet to have any success. And yet, all of the large e-cigarette and cigarette manufacturers have introduced products similar to JUUL with nicotine salts and high nicotine concentrations. And all that happened after August 8th of 2016. And some of the manufacturers weren't even subtle about it. The post-2016 launches of their products were covered by the press and trade publications. There is no mistaking the fact that these products should have never entered the market, and yet the large companies continue to sell these products. The FDA has sent a handful of warning letters to e-cigarette manufacturers regarding products that entered the market after 2016. But the only company among them that you would ever even heard of is Puff Bar, which came under scrutiny by public health groups and Congress and the media after it became the replacement product for JUUL. And again, the FDA's action came after Puff Bar had already voluntarily removed its products from the market. So it is crystal clear that there is mass violation of pre-market review by companies large and small, and the FDA's compliance and enforcement activities are not even remotely keeping pace. Now, hopefully that will change as we move into the next phase of pre-market review, where FDA authorization is required for products to remain on the market. I mean, I think we can hope that, because at that point, there is a much shorter and more discrete list of legal products, because it's only the products that would have received marketing authorization. And there is one other aspect of pre-market review that's worth mentioning now as well. You may recall that the FDA authorized the sale of IQOS in the not terribly distant past, and actually just authorized the sale of a new version of the IQOS device this week. When it did that, it has essentially allowed Altria and Philip Morris International, who market it jointly in the US, to sell and market IQOS in any way that those companies wish. Now, when the FDA grants marketing authorizations, it can put conditions on those authorizations. For example, it can limit how companies can advertise a product. But the FDA put absolutely no restrictions on IQOS. It requires PMI to maintain some records of its marketing, but it doesn't restrict marketing channels. Of particular concern, I'm sure, to all of us, the FDA did not limit IQOS advertisements on social media in any way. And the FDA was well aware of the risks given its investigation of JUUL'S social media advertising. But despite that, it only requires PMI to maintain records and include disclosures for things like paid influencers. So this was a huge missed opportunity for the FDA, and we should be wary of the FDA making the same mistakes as it begins authorizing the sale of e-cigarettes. Before I turn things over to Mark, I'll just address one issue that if I don't say anything about, I'm sure will come up in the questions. Yes, there was an election last month, and yes, the outcome of that election will absolutely affect how the FDA regulates tobacco products. And no, unfortunately, I have no idea how and to what degree. So, I mean, anything that anyone says at this point is going to be pure speculation because some of the driving factors behind policy are still unknown. What is certain is that the person who's nominated to head the Department of the Health and Human Services and the Food and Drug Administration will likely have a pretty big impact on what happens in the future. President-elect Biden has not yet identified a nominee for the FDA. He has announced that he will nominate Javier Becerra to head HHS. Becerra is currently the Attorney General of California. He is the successor of Kamala Harris in that role. I'm sure we're all acutely aware that Biden's nominees to lead health organizations will be far more scrutinized for their positions related to infectious disease rather than chronic disease. But hopefully the nominees will have some knowledge of tobacco control and if not, be willing to learn. I can tell you that despite my strong criticisms of the FDA, I remain encouraged by the leadership at the Center for Tobacco Products. Mitch Zeller has been leading the center for quite a few years now, and while he and I don't see eye to eye on everything, I do think that he cares deeply about the future of FDA regulation, and he has led that center through a very uncertain time. The incoming administration has already announced some cabinet level positions, and there's rumors of who will be nominated to lead various health organizations. You've probably seen plenty of information speculating about who will control the Senate and what sort of impact that might have on the nomination process. At this point, we just don't know with certainty what will happen. One aspect of pre-market review that's certain is the timeline. Because the deadlines for applications and securing authorization have been imposed by a court, they are now out of the FDA's hands, and that remains true regardless of who leads the executive branch. Other FDA priorities and actions that are not governed by litigation are just completely opaque at that point. So I am going to stop there. I'll turn things over to my colleague, Mark Meaney.
Thanks, Desmond. Okay, so can everybody see my I can't see anything but my screen, so I can, can I get a verbal notification that my screen is up, that we can get started?
No, it isn't up.
Nope, I'm not seeing them yet.
Okay, let me see, I did share it. Try it again.
Okay, they're coming through now.
Okay.
You go.
All right, glad I asked. Well, thank you for joining us in these strange circumstances, and I really appreciate the opportunity to talk to you today. As Neil said, we have had a long-term partnership between the Public Health Law Center and the state of North Dakota, and it's one that we really value. I was just thinking just today that one of the first trips that Desmond and I took, we both started at the center at about the same time, was on a flight to North Dakota, where we were the only two people on the plane, essentially, I think, except for one other staff member. So it was we took that, and I've driven a number of times, and one time I took a train to Mandan. So I've had all different experiences of getting to your wonderful state, and I did not expect this one to be via the internet, but I was hoping it'd be on a bike or a hot air balloon or something. But I'm going to be talking about some of the state and policy options related to specifically to e-cigarettes, but really to all tobacco products. And it's always a pleasure to follow Desmond, who takes so much really complicated technical information and is able to spin it into a really incredibly compelling story about the inactivity of the FDA. And it's very difficult to do, and I think I get the very easy job of saying, well, let's not wait for the FDA. We have plenty of authority at the state and local levels to move forward on public health, and that's really what we've seen historically anyway, is that the best public health policies have they begin at the local levels typically, and then move up to the state, and then hopefully at some point they make it to the federal level. So I'm going to just run through a few different policy areas, and I'm certainly not going to cover the universe of different policy options, and those are things that we can talk about either in the Q&A or at any other time after this. I'm happy to talk with you at any point. Desmond talked to you about who we are, the Public Health Law Center. We're located in St. Paul, Minnesota. I think he showed a photo of our team too, but I think it's nice to get a sense of who we are, and in the hopes that you can see sort of the breadth of experiences and knowledge that we have, and hopefully we want to break down barriers and make it easier to contact us, because we are funded to provide, as he said, free legal technical assistance on any issues related to commercial tobacco control. And again, Desmond covered this very well, and I wanted to say a couple other things. He mentioned that we do provide individualized legal technical assistance, and that's something that we really pride ourselves on. And that's because we think every community, every state, every jurisdiction is unique in its needs. And so one size fits all policies generally are problematic on some level. It's important to make sure that it's tailored to your specific needs. We do, in some cases, develop some model policies. I know there's been some questions about that, and it's something that we can do in certain circumstances. But generally, what we like to do is to talk to you directly and to come up with, to get a better sense of what your needs are, and to come up with solutions that are both going to be, legally defensible and are going to be evidence-based in terms of accomplishing your policy goals. And again, I'll stop the broken record soon, but it is really important that we do emphasize that all of our work is really done through a health equity lens. We work in an area and in the sphere of an industry that has really directly and intentionally and unfortunately very successfully targeted certain communities of color, people in lower socioeconomic strata, and has addicted those folks to its products. So it's important that all of our work is really centered on health equity and reducing those health disparities. Desmond talked a lot about the FDA and the Tobacco Control Act, but I just wanted to mention very quickly where the local authority comes. And there's a very explicit provision, I'll talk a bit about this a little bit later, in the Tobacco Control Act that identifies state and local authority. And really it gives broad express grant of authority to state and local governments to restrict and even prohibit the sale of tobacco products. It does not allow state and local governments to establish manufacturing standards or tobacco product standards, which typically fall into manufacturing requirements. But sales restrictions are very clearly under the authority of state and local governments. And I think that's important to point out because of the increased number of lawsuits that we have seen recently. And again, that's something I'm going to discuss in a few minutes. So just to kind of set out what state and local governments have the authority to do and what the FDA has the authority to do. So state and local governments have full authority over smoke-free, taxing products, and restricting or prohibiting the sale of a class of products. And those are things that the FDA cannot do. When it comes to manufacturing standards, again, that's solely under the authority of the FDA. But youth access, taxes and pricing, how products are sold, where they're sold, those are things that the state and local governments can and should be working on. So again, I'm going to talk just about a couple different policy areas, primarily tobacco retailer licensing, flavored policies, which I think are kind of the hot area around the country right now, where we're seeing a lot of progress, which has been very exciting for us, and then tax and pricing policies. And we think each of these three are really important fundamental policies to protect public health. And again, they're areas where we have seen a lot of movement, and so we're learning a lot more. There's a lot of research going into the public health effects as well of each of these areas, and we also think that they are all very strongly focused on reducing health disparities. But I want to start out with clean indoor air laws, because I do think this is something that I really want to commend the state of North Dakota on. That in 2012, when you passed your clean indoor air law, it was revolutionary. Really, it was I think, we didn't really know much about e-cigarettes at the time. I think we really, at the public health community, wanted to embrace the precautionary principle, and we did not know what the health effects of these products were, but I think it was exciting to see that the state included e-cigarettes in its comprehensive Clean Indoor Air Act, and I think that the evidence since then has really validated that decision, as we have seen more and more states and municipalities take that step and to protect its citizens' public health. And we've learned more and more about the health effects of secondhand aerosol. But getting back to licensing, so this is licensing is, as I think it's a permission that the government gives you to do something. It's not a right. It is really, in the commercial tobacco control world, it's a kind of the infrastructure, the backbone under which most other policies, at least point of sale policies, can function. And it's important because it provides uniform enforcement of the rules. It establishes protocols for penalizing retailers who don't abide by the rules. And it also really allows a lot of flexibility. And again, getting back to the idea that most policies are developed at the local level, it's where we learn. It's the laboratories of democracy, if you will. So we develop policies, and we can understand what works, what doesn't, tweak them, and then they kind of move up. So one thing that's nice about licensing policy is that each jurisdiction can identify those components that are most useful for its own community, and I think that's extraordinarily important, that type of flexibility. In North Dakota, licensing right now, I think, could be improved. It's really just done under the tax code at this point, and a very nominal fee, a $15 retailer fee, and it only includes certain products. As you can see, there are some obvious omissions here, e-cigarettes being the notable one, but also the $15 retailer fee is not in any way sufficient to pay for the cost of the program, which is really what where the cost should be established. So that's something, an area at the state level that could be amended and improved upon. But also a nice thing in North Dakota is there is not preemption of local authority. So local governments can, and I know some have, or at least I believe some have, implemented their own much more comprehensive tobacco retailer licensing policies. So the fundamentals of a good tobacco retailer license include all tobacco products. So the whole spectrum of products made or derived from tobacco, products that contain nicotine, the accessories, and then certainly all ends products as well. And licensing them all under the same licensing structure makes the most sense. Again, appropriate fees, ensuring that the fee structure is sufficient to pay for a robust enforcement, which includes a specified number of compliance checks, making sure that folks are following the rules, a clear identification of what is a violation. That's something that we work a lot on, making sure that it's that people know what the laws are, that there's education, that they know when they are following or violating it, and then graduated penalties. We know that one of the most important and the best, I guess, sticks in a carrot and stick analogy is to have the potential loss of the ability to do business. So so graduated penalties, fees, fines that increase, and then eventually leading to a suspension or a revocation of a license. And then, of course, always a process for appeals. We want to make sure that that's a part of any. There needs to be some due process component. So licenses can include what a business can and cannot sell. Recently, of course, as we talked about, there include a lot of flavor restrictions. So a lot of jurisdictions are restricting or prohibiting entirely the sale of all flavored tobacco products. And we'll talk more about this in a few minutes. I was at a meeting yesterday where people were talking about the sale of these larger volumes of pure nicotine products, and so I think I know some jurisdictions have started looking at whether they can prohibit certain concentrations of nicotine, but generally those could all fit. Those restrictions can all fit under a robust TRL. You also can identify where you can sell products. There's a lot of more research that's coming out on exposure to tobacco products leading to youth use. So, when products are sold closer to schools or closer to residential areas, there's more exposure, which leads to more youth initiation. Density, either the number in a community, you could restrict it to a certain number of tobacco retailers per 5,000 population, or some other number that makes some sense. Or what we do in St. Paul is restrict tobacco retailers or tobacco-only retailers, at least, from locating within a certain distance of each other as well. So they don't all locate in the same parts of the city, which I think is important again for because we do know, at least in larger cities, often there's a much higher concentration of tobacco retailers in areas that have larger communities of color and larger lower income communities. And then the type of retailer, you can restrict the sale, who can sell the products. It can be restricted only to adult-only, tobacco-only retailers, prohibiting the sale in pharmacies, and there are other approaches that can be taken to make sure that we don't have kind of health entities that are also selling tobacco products. Seems to make a lot of sense, and have been effective, and actually have been shown to be effective in reducing use as well. Next is minimum legal sale age, and I know that the state has looked at this. It has not moved up to 21 yet. This is one of the two areas that I talk about where we can look back, and we always know that the industry was far ahead of us in their understanding of the importance of certain policies, and so this is one that they had fought pretty vigorously for a number of years, knowing that increasing the age was going to decrease the use. And the Institute of Medicine report that was published a few years ago confirmed this, and then also showed that if the age were even increased to 25, it would much more significantly decrease tobacco use. But with the federal tobacco 21 policy, it makes a lot of sense for state and local governments to update your policies to make them more consistent with federal law, and then also that allows you to create your own enforcement mechanism, which can be a lot more robust than the federal law. And again, this is something that can be and should be a part of a tobacco retailer license. In addition to minimum legal sale age, though, you can also include a minimum legal age for the clerks to sell them, because we do know that youth use sales is one way where kids are getting the products, or even young adults are getting the products. And again, with all this, it's always really, really important to have a thoughtful enforcement and compliance mechanism in place. And then the most important part of this, and I think this is really universal with all the policies that we're talking about, is to really focus the penalties on the retailer. We know that the industry is trying to recruit replacement smokers, and e-cigarettes are just one more mechanism, and unfortunately it's been an extraordinarily effective mechanism for addicting kids to the products. And so that really does not make a lot of sense, and it hasn't been shown to be effective either to focus penalties on the youth users for purchase, use, or possession. I know that is currently a part of North Dakota's law, but we do also feel like that's a pretty important health equity issue as well. I think anytime that there is a potential for increased interaction between youth users and law enforcement, it can, it does not enhance public health, and it often just increases and exacerbates disparities. So focusing again on the retailer itself, not the clerks, but on the business that's selling the products is the most effective approach. Now let's move on to flavor restrictions. I think we all know the numbers, and I know that you've had, this is day 4 of talking about ends, and so I'm sure you've seen plenty of graphics on the number of flavors in the market and how appealing they are to youth users, as well as adults. But I think, the initiation, we know that it's one of the primary reasons for using, especially e-cigarettes, but also that's true with combustible cigarettes, specifically with menthol cigarettes. So this is something that has been, the cotton candy, we know these other 15,000 flavors are, many of them made it to be more palatable for kids' use. There's been a kind of an evolution in flavor restrictions When the Tobacco Control Act was passed, it prohibited the sale of all flavored combustible cigarettes except the most important one, which is menthol, which is the one that has been targeted very directly towards, specifically toward the African American community, but also the LGBTQ community. And also we know that it makes it more, again, a more palatable product to initiate with. But unfortunately, not for any scientific reasons, but it was not included within the Restriction and Tobacco Control Act, nor were any flavored cigars. So a huge gap. But when Providence and New York City, which were the first cities to enact flavor restrictions on tobacco use, New York City didn't include e-cigarettes either, but that was in 2009, so it was very early on. I don't think we knew quite what the scope of e-cigarette use is going to be, but they excluded menthol cigarettes, as did Providence, Rhode Island. The important thing about these policies, I guess there are a couple things, but one is that, they were enacted, and that, I think that showed locals had the authority, but that they were also litigated in two different circuit courts, in the First and Second Circuit courts. And going back to that first slide on the Tobacco Control Act that I showed, the court really relied on that language, saying that locals have the authority to enact sales restrictions, and so that was a very important milestone, I think, from a legal standpoint, showing that this authority does exist. It wasn't until a couple years later, though, when Chicago was the first jurisdiction to include menthol, which we were really happy about, although it was a very limited policy. It was only restricting the sales within certain distance of schools and youth-oriented facilities. But again, it was litigated there as well. And again, the argument was that it was preempted by the federal government, that these were really manufacturing standards and not sales restrictions, and the court said no, these are very clearly sales restrictions, and so they are allowed. And then, after that, we started seeing a lot more jurisdictions broaden the expanse and the scope of flavor policies. San Francisco, I have Duluth in here, but I think Edina, Minnesota, and a number of other communities in Minnesota as well now have full bans on the sale of all flavored tobacco products within the city. Last year at this time, or around this time, E-Valley, the concerns were focused on e-cigarette use and the hospitalization as a result of e-cigarettes, and that led to a lot of initially executive actions on the part of governors around the country to have temporary restrictions or prohibitions on the sale of flavored e-cigarettes, and then a number of states have moved forward with more permanent restrictions on flavored e-cigarettes. And you can see that there are quite a few of them that are either in process or have been enacted. And I think while we think it's great to move forward on flavored policies, we do think this is has a really potential to be problematic, because we know the numbers that Desmond showed earlier on the number of kids who are addicted to nicotine now and are using e-cigarettes, and we don't want them to be pushed toward flavored combustible cigarettes or to flavored cigars as a result of e-cigarettes being taken off the market. So while we commend the idea, we certainly want to see a comprehensive policy that includes all tobacco products. We've also seen similar actions on the part of tribal governments, and this part of this was initiated, I think, because JUUL really used kind of the old tobacco industry playbook by infiltrating tribes and really acting like they were working in the best interest of the tribal community, which already has very high rates of commercial tobacco use as well. And they would, providing free products in exchange for certain information or reduced rate products. And it was really, it's really unfortunate to see this, this is what had been done in the African American community by the industry for many, many years in an attempt just to addict and sell products. But we are seeing some really comprehensive policies, and they are expanding very quickly, even this year when there wasn't a lot of local activity happening because of, because of COVID. Massachusetts, California has both have over 100 localities that have passed comprehensive flavor policies. Minnesota has seen a huge increase, and then Colorado, which had been essentially preempted from enacting these policies until 2019, when that was repealed at the state level. Now has seen movement in a number of jurisdictions, so that's been exciting. And then, of course, at the state level, Massachusetts and California both passed statewide policies. I will say, though, in California, their policy was passed, and it was immediately, there was a lawsuit filed, which I will talk about in a minute. But in addition to the lawsuit, they also have a process in place where the industry has been able to gather enough signatures, we believe. They haven't been validated quite yet, I don't think, to at least put the implementation of their flavored policy on hold. It was supposed to take effect on, I believe, on January 1st of 2021, and now it will be likely on the ballot in 2022. So they just sort of bought themselves 2 years, unfortunately, at the state level. I'm sure you've heard about all of the lawsuits related to flavored policies, and there have been quite a few, although I think when we look at it in the scope of the number of policies that have passed, it's still really just a fraction of the policies that have been passed that are litigated. There are a number of them in, I mean, I think I talked a bit about Providence, New York City, but currently Edina, Minnesota has an ongoing lawsuit, and again, it's very similar to what we've seen before, arguments that it is preempted by the Tobacco Control Act, and there are a couple that are ongoing right now in California. There's in San Diego, the R.J. Reynolds versus Becerra, as Desmond mentioned. Javier Becerra is the current Attorney General for the state of California, and that's on the SB 793, the state level bill that I just, or would-be law that I just talked about in my previous slide. There's also been litigation in LA County, again on very similar policy, and that one the district court upheld the policy and said it was very clearly, again, it was very emphatic, actually. It was very nice language saying that it was a permissible sales restriction. So I think really the takeaway with the litigation is that while it seems like there has been a lot of it, and there has been more in this area than we had seen over the last few years, that to date, every single policy that's been enacted has been upheld by the courts, and I think that's really an important takeaway. So we talk about the best practices for flavored tobacco policies. Again, comprehensive, all flavors, all products is very important. We don't want to have a situation where it's focused just on one product and it's sort of creating a funnel to something else, especially for youth use. Jurisdiction-wide is ideal under a strong retail licensing law. We are seeing a lot more of a push for different types of retailer exemptions, and I think this is an important point because we know that exemptions are never implemented, they're never pushed forward for any public health purpose. They are always for some business interest, and they really end up almost always, again, increasing health disparities. So in California, we're seeing a lot of this push toward exempting hookah bars. And I don't know if you have a lot of hookah bars. They tend to be, we've noticed, we're learning at least, they're locating around college campuses. But there's been I think a push to create kind of a false narrative that these are, cultural use of the products, and really the reality of how they were being used. And we're getting to learn more about that. And there's been some researchers who are working on this specific issue. It's really, the flavors are much more typical to what we're seeing with e-cigarettes and the very kid-friendly flavors. And then we're also, I think jurisdictions are moving kind of on the continuum and saying, okay, these products can only be sold in adult-only, tobacco-only retail stores. So that would be kind of moving in that direction of restricting the sale. The other thing I would say that's really important with if you're considering a flavor policy, if your community is to really think about how it's going to be enforced and learn about how to educate all of the retailers. It's important for them to know what they can and cannot sell. I think that ends up resulting in much better and more effective enforcement. And I think it, creates a better partnership, even though I know that most of them, the retailers, are very, very opposed to such policies. But also, I think it's also important to learn from other jurisdictions. One of the biggest concerns and difficulties with implementing flavor policies is when it comes to these what we call concept flavors, where the industry has created, either they'll kind of indicate that a product is flavored either by its name, calling it Maui Wowie, or Black and Mild Jazz was one that there's been some litigation on, or packaging it in such a way in purple packaging that indicates that it's a great flavor without actually explicitly saying that. And so we do have approaches, and so we'd be happy to talk to you about that, about how to most effectively narrow the scope of the products that are kind of causing the problems as much as possible. But it's important to sort of be thinking about those when you're drafting it. So we've certainly been dealing with that around the country, and we can help you come up with language and think about some of the issues that should be considered on the front end. And then, as I said before, I think there is definitely an interest by the tobacco. We know how important this is to the tobacco industry based on the lawsuits that they've been filing just in the last year or so. And so far, all of them have been upheld, as I said before. And I think that the other side of that is, I think what they're doing is trying to find a circuit court split. So they're trying to, and North Dakota and Minnesota are in the same circuit court. So what happens in Edina could potentially have an impact on authority in North Dakota. But again, we are very confident that these policies are well within the authority under the Tobacco Control Act. And this is the second time I will say we listen to the industry. They know that taxation is problematic, that anything that will increase the price for the products both encourages existing tobacco users to quit, but also decreases the likelihood of kids to initiate use. Kids are the most price sensitive consumers. We've known that. I mean, this is now nearly 40 years old, these marketing reports from the industry. I'm going to talk about e-cigarette taxation a little bit, and then just a couple different pricing policies. So with taxation in general for tobacco taxes, there's really they're set up in one of two ways: either a kind of a per unit tax, and that could be per pack of cigarettes, could be per ounce of chewing tobacco, or it could be per milliliter of e-juice, something like that. The other approach is to do an ad valorem tax, which is according to the price, so a percentage of the wholesale or the retail price. Basically, those are the two general ways to tax tobacco products, and then it gets a little bit more complicated. Excuse me. And then for pricing policies, those are non-tax policies that are intended to increase the price and reduce the use of discounts and things that have kind of a psychological effect, making it feel like you're getting a deal, and increasing impulse purchases, things like that. Tax has been an area where I think right now there is an opportunity that we haven't had for many years in a number of jurisdictions in a number of states. I mean, I know that taxes is definitely a four-letter word in a lot of places, but because of the budgetary effects that are going to be the effects of COVID, we know that there might be an opportunity for tobacco taxes to be raised. Obviously, we, it's a terrible reason to get there, but it's, I think we want to seize this opportunity when we can, because we know that also tobacco use has comorbid effects with COVID too. So we want to decrease use any way we can. Tax policies are one of the most studied areas in tobacco control, at least in terms of cigarettes. We know that they have been proven to be cost effective. They reduce use across the board, especially with kids. Low-income users are more likely to quit. And then ideally, with any tax increase, it also will include additional funds for tobacco control programs, which have been studied also in many states and shown to have significant return on investments, 5 to 1 to 20 to 1 in some cases. So we know that they do save money So ideally, that's part of that on the front end when the tax is enacted. We get a lot of questions about equity and tax policies and whether tobacco taxes really are a regressive tax because, again, as we all know that it's generally lower income folks, people of color who are using tobacco products, and so is increasing the tax really just taxing people who can least afford it. And I think there is, something we want to be aware of. There's a lot more research again going into this as well, and I think what we're doing is looking at. I think the conclusions that we're looking at this that approach is looking at it too narrowly. That tobacco use itself exacerbates poverty and increases health disparities because so much of disposable income goes to the products themselves. Not to mention the loss of work and then the loss of quality life years as a result of tobacco use. And so when those are weighed, the people who are smarter than me, the economists who have looked at this really view this as it's not even close at all, that they are not regressive policies, but it's also important that they are structured in a way to give people an off-ramp, to have free cessation that's tailored to existing tobacco users. We know that many tobacco users want to quit, so they just need the opportunity and the off-ramp, and sometimes the increase in price and the opportunity really doubles the incentive to quit tobacco use. And then again, I think the tie with COVID cannot be ignored at this point. How it's exacerbating the effects of COVID. I know that's been a way that there have been parties where e-cigarette use has been shown to have been responsible for creating clusters of COVID outbreaks. So we know that there are other types of health effects we hadn't really thought about 6 months ago. So the current tax landscape, all states tax cigarettes by the pack or by the mils per cigarette in some cases. North Dakota has one of the third lowest tax in the country at 44 cents a pack. So certainly there is room to move that up. North Dakota also taxes different products in different ways. 28% of wholesale price for cigars and pipe tobacco, and then chewing tobacco and snuff are taxed based on their weight. These can be more complicated ways to tax the product. Minnesota has a very flat, for all non-cigarette tobacco products, are all taxed at a 95% of the wholesale price, and that can be an easier way, more consistent way as well to have that kind of parity taxation among all products. For e-cigarettes, though, it seems like it's an easy thing to implement, but we've found that it really is. It can be more complicated, especially depending on how the tax is structured. We've seen the evolution from the little handheld bomb for those who are willing to take a bit of a risk, for 20 years ago, to the whole variety of products that are on the market now, the open use and closed container systems and the disposables. So taxing all of them as if they are one product it can be difficult. So I think we need to think about them as a universe of products. And then I think the questions that we think about. I know we're going to talk more about this after I am finished here, but what products should be taxed and what level should they be taxed at, and whether it should be, for example, only nicotine products, or whether it should be nicotine and non-nicotine e-solution, whether the devices should be taxed as well, whether there should be some sort of a differential taxation based on the perceived risk or the real risk of the products. I think all these are very difficult to implement administratively. We don't know what the risk is of these products. We don't have enough long-term information to know that. So our view is really that all the products should be taxed at the same rate on parity with other tobacco products. And that includes nicotine and non-nicotine. We have seen, a lot of misinformation put out by the industry on which products contain nicotine, which ones don't. And I think that can be difficult to ascertain. And even we've seen some places where they do tax just the nicotine. We've seen nicotine sold separately from the flavorings, and so you end up having really high concentration of nicotine, which is in itself is problematic. to be mixing. So I think there are some other unintended public health consequences that need to be considered too. And then for approved cessation of products, we don't include those in our definitions, and we don't feel like they should be taxed at the same rate. But we also, it's important that they are approved by, that they go through the FDA process, which is in place. The other thing I would mention is that there's also, as you probably know, a process at the FDA to be determined to be a modified risk product. And so we're seeing a lot more attempts by the industry to get modified risk products to be taxed at a differential rate, like 50% of the rate of other products. We don't know how much of a modified risk. The FDA doesn't tell us that. And so our view is that modified risk is still a high level of risk. And at this point, it seems to be a better approach to just keep the taxation the same for all of these products, except those that are cessation. The structure of the tax, the ad valorem approach, again, is our preferred approach. It's easier administratively because it's a percentage of the price. It's inflation proof. As the prices go up, the tax also goes up. It doesn't require going back to the legislature to increase the tax if it's based on it's the dollar amount or per unit amount. We get a lot of arguments that from the industry that volume is the better approach, and I've actually been on panels where people from the industry have argued that they don't know. It's really difficult to tell. They said whether a 5 cents a milliliter approach is a tax is going to be higher or lower than a tax on a pack of cigarettes. And we know that that's really just an absurd argument, that 5 cents a milliliter, if a JUUL pod has 0.7 of 1 milliliter, it's essentially a 3.5 cent tax per JUUL pod, and a JUUL pod is about the equivalent of a pack of cigarettes. And so it's extraordinarily low, and that's why they are pushing a 5 cent per milliliter tax in many places. Some jurisdictions have gone with a bifurcated approach, an open versus a closed system. A couple places have thought about trying to figure out by concentration. That seems really, really administratively difficult to do. I think, again, we go back to ad valorem, a percentage of all the of the price of the whole product seems like a preferable approach. And then where is it collected, the distributor or retailer level? And this is, I think there's still some uncertainty about the better approach for this, I think, because in some cases the retailer is functioning as a manufacturer if they're mixing any products on site. That is the case. So we do want to make sure that we're getting the final product before it's going to the consumer, so you're getting the full value. The tax is being assessed and levied on the full value of the final product. So our best practices, again, just a conclusion on this piece is that, again, ad valorem, so a percentage of the price at the same rate as other tobacco products, and then including all nicotine and non-nicotine products. And we say all the functional components of the devices, and that means anything that's kind of sold with it that functions as a part of it, not a separately sold lanyard. And then also, if you were to sell batteries, that especially if they're kind of a universal use battery that might be sold at a Target across the street or something, those would not be included unless they're sold with the product. And the retailer level seems like the approach that makes the most sense. But retailer or distributor level, I think either one, if it's depending on how the existing system is already set up. But again, TRL, I will keep talking about that, but I think it's important to have a licensing in place. And then pricing policies, again, these are just ways to keep the price up to a certain level and reduce the use of discounts and coupons. These again can be a component of a strong tobacco retailer licensing. These were also litigated in Providence and New York City as well, and upheld as sales restrictions that are appropriately under the authority of state and local governments. One thing about these is that about some of the pricing policies is that often retailers are not opposed to these, because in some cases they can be the beneficiary of higher prices. And so these can be restricting the redemption of coupons. It's more important to focus on the redemption versus the distribution, where you can get into some First Amendment problems. Not allowing sale prices, and in some cases now we're starting to see price floors. We've seen them in with cigarettes primarily, and with cigars, but we have now just seen the first jurisdiction where we help draft language to increase the minimum price for e-cigarettes. And so I think we're going to see more of that, just trying to make sure that there's some sort of an economic barrier to entry. So just generally, when developing an effective policy, use the evidence, as much local evidence as you can find, comprehensive definitions. Looking at the implementation is always, we say, that's essential on the front end, making sure you know how it's going to be enforced, talking to the enforcement folks, and making sure that's drafted in a way that it makes sense within the existing structure. And then always important to designate the funds on the front end. Once a tax policy is passed, and it's going to the general fund, it's really difficult to pull that back out. So while it's being drafted, that's the time when it's good to get it directed toward tobacco control programs. And then we feel like a suite of policies on all tobacco products, and that's certainly the case in North Dakota, where there's a need to increase the price of all tobacco products, including cigarettes. Advertising and marketing restrictions, those, there's some authority for those. We certainly feel like those are kind of the last line because they are more problematic. There are a lot more legal issues involved with First Amendment problems with restricting advertising. So we certainly discourage that in most cases, but we're happy to talk to you if there's something you're interested in doing in that realm. And most of these, again, we're moving toward the hope that we're going to eliminate the use of tobacco products entirely, this end game idea. And we're starting to see that in some communities where they are restricting the sale of all tobacco products, and that's very exciting news. Now, I mentioned preemption. It's something that you don't have to deal with right now in North Dakota, but it's always important to be on the alert for preemptive laws that are going to restrict local control. The industry has been very active in attaching preemption to all kinds of bills, some that are in tobacco control bills, some that look like they are going to have positive outcomes but have preemption attached to them, and sometimes they are just kind of out of the blue in other areas where you wouldn't expect them. But the bottom line with preemption is it's never a good trade-off. It always ends up just harming public health. Then finally, with policy drafting, similar to what I said before, it's really important to show what the legislative intent is, to have a finding section why you're doing this, what's the importance of this, and that's something that we can certainly help you with. But there's so much clear evidence on why we're doing what we're doing, what the outcomes of particular policies are going to be, and what the problems are. Clear, consistent definitions, comprehensive definitions of tobacco products that exempt FDA-approved cessation products. I know we've heard that there are certain other products that they're making cessation claims, and that is something that's both inappropriate and illegal, and can be reported to the FDA, including enforcement provisions. Always having cessation as a part of any policy is extraordinarily important. We suggest including anti-preemption language specifically to show and to indicate that the intent is to allow for stronger local laws if this is done at the state level, and not to be self-serving, but we do think it's we encourage you to consult with us. We are happy to talk to you. It's what we do. We are funded to provide free assistance, and so we can help you hopefully avoid some of the pitfalls and to develop exactly what you want them to do, and they're going to do it in a way that you won't result in litigation. We have a lot of policies and publications, a lot of resources and webinars. The timing is kind of perfect. We just published with the University of North Carolina policy playbook guide on e-cigarette, state and local e-cigarette policies. And there was a webinar earlier today, which I think you can go on our website probably as early as tomorrow and listen to that if you're interested in it. But the publication itself just went up, I think it was earlier this week. So I encourage you to check that out if you're interested. And that is all I have. So thank you again for your time.
Thank you so much to both Desmond and Mark. My name is Abby Erickson. I am the Community Programs Coordinator. Really appreciate the legal expertise that is available from the Public Health Law Center, and would remind our partners that we will facilitate that individual consultation that Mark was talking about for any policy needs in your local community. We'll hold the questions until after our last speaker, so please do take a moment and enter any that you may have in the question and answer box. We'll take a 5-minute break, allow you a quick moment to stretch and refocus. I currently have 2:24, so we will start at 2:31. Thank you.
Sorry, Abby, I went a couple minutes long. I apologize.
No worries. Well, we will bring everybody back. Apparently, I can't add 5 minutes. I gave you 2 extra minutes. I do hope you enjoyed that. I'd just like to take a quick second and introduce our third and final speaker today. We have Heather Austin from Tobacco Free North Dakota joining us, and she's going to share some North Dakota specific ENDS policy initiatives. Heather joined the team at Tobacco Free North Dakota in October of 2016, and she has over 14 years experience in the nonprofit industry, with 5 years at the Bismarck-Mandan Chamber of Commerce and another 5 years working for statewide organizations in addition to TFND. Heather has built relationships and coalitions across North Dakota. Working with people and bringing groups together is her favorite aspect of this work. Personally, Heather has a husband and 2 boys, enjoys travel time with family and friends, bowling, and reading a good book. Heather is passionate about creating North Dakota's first tobacco-free generation by working to create policies and programs that prevent our youth from beginning tobacco's dangerous addiction. Welcome, Heather.
Thank you so much, Abby, and thank you to our partners and the team at the North Dakota Department of Health and all of the presenters that have come before me. I'm excited to bring this home and wrap it up for the ENDS Summit Series 2.0. I will be sharing quite a bit of information rather quickly, and I am going to try and leave some time at the end for the question and answer session that has been promised, so that if folks want to ask any of the presenters today, myself included, any questions, we can address those at the end of my presentation. I'm actually very lucky that the previous 2 presenters, both Desmond and Mark, have done such a wonderful job laying the groundwork for me today in my presentation. They truly have provided much of the logic behind what we're doing, as well as a lot of really great background on the methods in which we're going to propose doing some legislation for our great state of North Dakota. That being said, I do have a PowerPoint presentation that I will share some slides on, and some of the slides I'm actually going to breeze through as the information was covered by our previous presenters, but just by way of background, I'll tell you a little bit about Tobacco Free North Dakota. We are a nonprofit organization. We are nonpartisan. We have a board of directors that live and work across the state, and so we try and advocate on behalf of all communities in North Dakota, and our mission is to improve and protect the public health of all North Dakotans by reducing the serious health and economic consequences of tobacco use, and that does remain our state's #1 cause of preventable disease and death. Just a little bit of North Dakota specific data to complement all of the other great data that we have reviewed today. The toll of tobacco in North Dakota is quite high still. 1,000 adults die every year in our state due to tobacco attributed diseases and illnesses. And every year 300 kids under 18 potentially become daily addicted smokers. And I think it's important to note with a lot of the data that I'm sharing is it doesn't take into account a lot of the new ENDS data that is coming out or vaping related specifics, simply because of how vaping products and ENDS products are classified in North Dakota. Electronic products currently are not classified as tobacco products, and so they're not tracked or monitored or included in a lot of the data that we are able to review. So that being said, it's very costly in terms of our health and also in our dollars. $326 million per year is spent in our state on tobacco-related healthcare costs. We also have data showing around $239 million being spent on lost productivity costs for our populace. Oops. There we go. A little bit of some trend data that is North Dakota specific. High school grades 9 through 12, the current smoking trend, as you can see, has gone down, 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 which is excellent news, representing decades worth of work in the public health industry. Our current smoking rate in the 2019 YRBS data, the Youth Behavior Risk Survey, is at 8.3%. Our current smoking rates for adults has kind of plateaued and remained steady. The new 2020 data has been released, and I have it on a different slide, but it does show it at 17% for our adult rate in North Dakota. But this does go to show that tobacco use is still a problem. And as you can see by this slide and some of the e-cigarette use being added in, a lot of the decades worth of work is now being undone. Our high school student e-cigarette rate in the 2019 YRBS data is at 33.1%. So as our smoking rate has declined, you can see the transition to these electronic products for our youth has really undone a lot of the good work over the last many years. And I think Desmond showed some really excellent data behind why that is happening. And I think Mark provided some excellent resources and suggestions on how we can combat that from continuing to climb. Again, this is just a little bit better of a breakdown on the questions asked in the Youth Behavior Risk Survey, the most current year being for 2019. This is an every other year survey that's taken across our state. And I think just a few key takeaways from this slide are that you can see students who've ever tried an electronic product is at over half in the 2019, which I think is pretty astounding. Over half of our North Dakota kids in grades 9 through 12 are letting us know that they've tried these products, and then at least having used them at least once during the 30 days prior to the survey is where we get the 33.1% for the current use rate. I think the other important things to note on this slide are the frequent use, meaning 20 days or more during the previous 30 days is at 12% of our youth, and students who currently use daily has more than tripled to 8% in this survey for 2019. That's quite astounding. Again, you can see the breakdowns of ever tried ends versus currently using ends. Our kids are experimenting, and they are drawn primarily by the flavors, as was discussed by the previous presenters. They really are attracted, to the flavor aspect, and it makes it seem like these products are much more innocuous than they are. It makes it seem like they're safe because they taste like things kids are familiar with. The fruit flavors, gummy bears, cotton candy, food flavors, and so it really is detrimental having that for our kids. And then here it compares a little bit of current cigarette smokers versus current ends users by age group, and you can see that there is some correlation between age and how these products are being marketed to the current use. This was also mentioned a little bit, and I think this data is interesting. And it was completely overtaken by the pandemic, of course, but up until March, early spring, E-Valley, the electronic vaping-related injuries or lung injury cases were being tracked nationwide and statewide, and it was very concerning, and we saw it as even further data and proof showing the need for regulation and rules, in particular in North Dakota. But since that time, a lot of the tracking has kind of been put on pause as COVID-related needs overtook not just our state but our country. I'm going to breeze through some of this, but a couple of key points I want to make is, nicotine is a drug. This is what is being derived from the tobacco plant, for many of these products. And for our kids, it was alluded, to the addiction problem and the epidemic that has been created because of these electronic products. I think it is important to note, and I was happy to hear Mark talk about the need for cessation related services and having a game plan and how to help people quit these products, but we can't punish away this problem for our youth. If they are addicted, they do need help, whether that be through counseling or, doctor prescribed nicotine replacement therapy or things like that. And so just by way of some background, this is something that we talk about even with our policymakers as we're proposing policies, that we do have, things put in place to help with the addiction aspect of things. I'm going to breeze through some of this now and get back into products. We've had a great overview on products. I won't, beat a dead horse or belabor the points that have already been made, but just knowing that we are going to try and be as comprehensive as we can be in some of our proposals to scoop up a lot of the products that currently aren't covered in North Dakota state law or policy. And so I just think it's important to note kind of the evolution of these things and where we've come from in terms of the ends products that have hit the market. And I think it's also important to note that it's not necessarily a vapor that's in these. I know we use some of these terms interchangeably, from vaping, e-cigs, ends products, electronic products. They're all kind of talking about the same types of products, but they do emit an aerosol and not necessarily a vapor. Water vapor can be construed as being more harmless. But really, the cocktail of things inside an e-liquid is that is transformed into an aerosol has very little water to begin with. It's a lot of chemicals, flavorings, aside from the nicotine content that's in there. And so I think that's also an important delineation to note. And I think that the next generation, making sure that we use these types of terms in the correct manners as we're talking to policymakers can be important, and not just regulating what's currently on the market, but anticipating what could come. And then the high concentrations of these things, the market share that has only climbed, by JUUL, which I think was highlighted quite nicely in the previous presentations, is important to take note of as well. And it's billions of dollars on the line, and that's why you see so much litigation, that Mark pointed out, from the industry and from, these companies have invested in these types of products. I mean, it's literally billions of dollars on the line, and they're not going to give that up easily. But I think we need to make the case, that in some instances, health and livelihood of our citizens needs to take precedence. I'm going to just brief through a little bit of this, other than to show quickly, we've talked a lot about JUUL and the pod-based systems. It is continually evolving. If you look up into the upper right-hand corner of your screen, you can see some of the newest models coming out, attempting to claw some of that market share away from JUUL and its copycats. And so they're always going to keep evolving into new types of systems, refillables, pods. I know a lot of that has started to be seeing some regulation, at the federal level. So there's still always hope there, but as the industry sees policy put into place, they're always going to figure out ways to circumvent that policy and make us have to go back and redo our policies. So just be aware of that. This was covered quite nicely as well in the previous presentation, the disposables that have hit the market to answer back to some of the regulation that was imposed on the cartridge or the pod-based systems, and how their market share has only climbed, and these are especially attractive to our kids. And so, and then the stealth products that we won't get into today, but just be aware that they do exist and they are ever adapting as well. So that being all said, tobacco-free policies and what we tend to look at in terms of moving the needle, and a lot of this was covered pretty in depth, and so I'll just kind of reiterate that this is what we work very hard to put forth, and we have been working with the Public Health Law Center to develop the policies that we're going to promote and propose during our upcoming legislative session. And what you are going to see in our bill proposals isn't necessarily everything that we could be doing. We do have to prioritize, because North Dakota is lacking in so many areas of tobacco prevention and control policy. We do have to prioritize what we bring forth each legislative session, in the hopes that we can rally around certain things to give them their best chance of taking that incremental step forward, and hopefully eventually passing and being put into law in our state. And so increasing the price of tobacco is always, front and forward for us. Fully funded comprehensive prevention and control program, classifying ends as tobacco in North Dakota, protecting our indoor smoke-free air law, tobacco 21 ratification, banning flavored tobacco, mint and menthol being included, tobacco-free grounds, schools, parks, all of those types of things. So these are policies that we tend to look for front and center for North Dakota. So three-legged stool is where we are going to be concentrating for this upcoming legislative session. These are the best practices as promoted by our Center for Disease Control for policy prevention. We do have a very strong smoke-free air law. I'll get into that more in just a moment, but it was nice to hear that highlighted this afternoon as well, because North Dakota really does have one of the best in the nation, and the fact that they did have the foresight to include all the ENDS products and anything that can be aerosolized, vaporized, any type of tobacco product, any type of, any product for our indoor smoke-free air law is really excellent, and we want to make sure that we can preserve that, and then the high, tax increase, and then the comprehensive funding. So here's our policy agenda, and you're going to see a series of 5 bills being promoted by Tobacco Free North Dakota for this legislative session. Our main bill is our comprehensive bill, as we call it, and this is a bill that was adapted from what we put forth last legislative session for the 2019 session, and both times we worked closely with the team at the Public Health Law Center to craft our legislation. They have been an excellent resource. I can't thank them enough. I can't promote them enough. As you have seen this afternoon, they do an excellent job of thinking of every possibility and contingency that we should try and plan for, in the hope of making our policy language as strong as it possibly can be. And so all 5 of our bills, we worked with the team at the Public Health Law Center to craft and think of everything that we could possibly encounter for the legislative session. So our comprehensive bill would classify the ENDS products as tobacco products in North Dakota. It would require them to be licensed and regulated in parity with all the other tobacco products, the way they currently are licensed and regulated in North Dakota. It would include an ad valorem tax rate, wholesale percentage of 28% across the board on all types of tobacco products. Mark mentioned that in North Dakota, tobacco products are taxed at different rates. Some are on a per mil basis, some are the 28% ad valorem wholesale rate, some are the weight based. We've heard talk about the milliliter possibility for the ENDS products. Our comprehensive bill would try and actually clean up some of North Dakota's tobacco policy and create additional parity by having them all face the same ad valorem tax rate of 28% of the wholesale price, which already exists for the cigars and cigarillos. And so we feel like that would be, kind of the most common sense way to address the tax code for tobacco products in North Dakota. And our hope is that it, seems that way for our policymakers as well. The comprehensive bill also adds in something a little bit different from the last go round that we saw a need for, and that is to prohibit internet sales of tobacco products for North Dakota. It would require a face-to-face sale or an over-the-counter sale for all tobacco products in North Dakota. And this is actually modeled on a bill that South Dakota, our neighbor to the south, just passed last year. And so we thought that that was a good idea in terms of helping keep these products out of youth hands. Even further, helps promote North Dakota businesses as an aside, and it just makes sense to have that be included. It also has the effect of tightening up some of the regulatory or monitoring capabilities and compliance checks capabilities that are important for these types of products too. So in a nutshell, that's the comprehensive bill. It, like I said, does those main things. And then because we had our bill, falter last legislative session, and it actually did get turned into a study that was taken up during the interim, which I'll talk about in just a moment. But because that happened this year, we decided rather than having just one comprehensive tobacco policy bill, we're actually going to break that bill up into a few of the more key pieces and have separate standalone bills for each of those pieces to give everything its best shot of going forward. And so after the comprehensive bill, you see 4 other bills that just take pieces of that larger bill as standalone policy. And so one of them is an e-cig bill or an ENDS product bill, and that takes that portion out and does all of the things around the electronic products that North Dakota has a need for. So it classifies them as tobacco, it puts in the licensing requirement, it adds the ad valorem tax rate of 28% of the wholesale price, and does all of that work. And because ENDS products aren't included at all in any of this, we feel like this is a pretty valuable piece of the comprehensive bill that we want to give its best shot forward. The other standalone bill that we busted out of that is an internet sales bill requiring the face-to-face transactions for tobacco sales in North Dakota. We took out the age 21 ratification as well as a standalone bill. As was said earlier, it's important, even though it's at the federal level, for states to ratify that law because it gives you more local control. It adds the local enforcement capabilities, and then it also protects the law from, if it's ever undone at the federal level, we still have it on the books at the state level. And due to some of the preemption talk that we were discussing earlier, we're protected from having it go away. So if we have it on our books at the state level and something were to ever be rolled back at the federal level, North Dakotans would still be having the purchase age of 21. And then we also have a standalone cigarette tax increase bill. So if all else fails and we can't get the across the board ad valorem tax rate, we do have a standalone bill that would simply raise the tax on a current pack of cigarettes by $1, and so it would keep at the per mil basis that's already in existence in our tax code, and simply raise our cigarette pack tax rate from 44 cents to $1.44. And so those are the main bills that we are going to be putting forth for the legislative session. Another key tenet of our policy agenda, though, that I actually want to spend a couple minutes talking on is defending our indoor smoke-free air law. As was said, it is one of the strongest in the nation. North Dakota has enjoyed it for a number of years now. In fact, that's part of the problem. Our indoor smoke-free air law was put in place in its final iteration by an initiated measure. And in North Dakota, an initiated measure cannot be undone or changed for 7 years without a 2/3 majority vote in both chambers of our state legislature. And last legislative session in 2019, this law actually kind of came under attack for the first time. Our legislators, fortunately for us, maybe unfortunately for them, didn't realize, though, that the 7 years hadn't sunset on the initiated measure. It was put in place in 2012, and it wasn't due for its 7th anniversary until December 6th. And so they needed a 2/3 vote to change that law. And the attack that they had come forth, or the law that they were proposing, was an exemption to create what we dubbed cigar bars, but they wanted an exemption to have indoor establishments authorized to have certain products available to be smoked indoors, cigars or premium tobacco. And this was problematic in a few different ways because, first of all, premium tobacco doesn't have a definition, so it could be any number of products that are included, depending on how the industry starts to try and define things or classify things. And we know that it can be a slippery slope when cigars are authorized, because hookah next, or vaping establishments, or any type of rollback kind of paves the way for the next exemption. We also know that there is no safe level of secondhand smoke. We know that shared walls and ventilation systems are really problematic if it's not a standalone establishment, because then all of the people that share your walls or share your vents are now sharing your secondhand smoke. And so it was very concerning for us, and we like I said, staved off that attack last go round, but mostly because they needed the 2/3 majority to get it passed. They didn't have that, but by our count, they were very close to having a simple majority. And so we fully expect to see that bill, or an iteration of that bill, come back again for this legislative session. In fact, we've already heard rumors of not only that coming back, a cigar bar type bill, but also a bill that would simply just undo our indoor smoke-free air law in total. And so a huge tenet of our legislative agenda will be talking with our policymakers and raising grassroots efforts around preserving and protecting our indoor smoke-free air law. And again, these are all, you can see the main point of our legislation this go around, or our proposed legislation, is the three-legged stool of policy. And so that's where some of that comes from as well. This is just a couple of tables and maps showing how we compare with some of our neighbors in terms of, it says how high are vapor taxes. These are, ends products taxes, and then the cigarette taxes. North Dakota not having one at all, and then being one of the very lowest in the nation for the other, shows just how far we need to go in terms of our policy work. So this is part of what we're going to be asking some of our coalition members to help us do, to talk out talk out, excuse me, to use their voices and speak out to policymakers about, what we want to see in terms of, tobacco prevention and control policy, how we want, things to be fulfilled for our communities, how we want these kept out of our kids' hands, how the health of North Dakotans needs to take precedence. And so we have already been talking with our legislators these past many months. We've had several of them helping us craft these proposals alongside, our partners and our local public health folks, our, the Public Health Law Center. We really try and bring a wide coalition together to get these policies not only put together, but then to help lay the field for the education and advocacy that has to come behind. I know many of you have participated in some of our messaging campaigns, some of our media campaigns, some of our social media campaigns. We have individuals and youth that have stood up and provided testimony and firsthand experiences about their communities and their schools. And so these are all things that we're going to be putting together again for the upcoming legislative session. Some of it is actually already in the works. And so I guess this would be an invitation to anyone watching this presentation. If you want to get involved, we can help facilitate that and make sure that your voice is heard alongside many others. Here are some of the materials that we've already been working on. For these specific policies that we're promoting. We have resolutions of support that businesses, organizations, boards can sign on to for each leg of the stool. We are specifically concentrating, as always, on our price increase, but we also have resolutions and individual support cards broken out for the preservation of the indoor smoke-free air law and the fully funded comprehensive program. And just a side note on that, our comprehensive program funding has, taken some hits the last couple of legislative sessions. It's actually decreased by more than 40% over the last 4 years. And so part of our advocacy this go around too will be to be ready to advocate for, at least a preservation of where we're at now for current funding levels, but to actually ask for a reinstatement of some of that funding to continue to do the good work across the state that we know needs to be done for, public health and that. And then I'm just going to breeze through the last parts of these here because we are running out of time, but social media and messaging, we have pre-written posts, pre-written print ads, things that you can have for free to use in your communities or your organizations. Community-wide activism still is important, and voices across North Dakota coming together does have an effect, especially when constituents tell their legislators what they want. And using the tobacco holidays throughout the year and coalitioning together to create strength in numbers becomes really important. With that, I see we're just shy of our cutoff time, and so I'm going to turn it back over to Abby to let us know if there are any questions out there for myself or the other two presenters. But I just again want to thank you for this time. We know that what we're proposing is a pretty heavy lift on our own, but all together we really do feel like we can move the needle forward and actually see some policy put into place for the first time in many years in North Dakota. So thank you.
Thank you, and thank you to all of the speakers today. We will now take some time for questions. There are a few in the box. Do take some moment and enter if you have any others. The first one I believe came through when Desmond was speaking. So I will turn that over to you, Desmond. And the question is, if they cease distribution in the U.S., how is Puff Bar sold in the U.S.?
That's a good question. Illegally is how they are sold. Yeah, I've been getting this question a lot. It's pretty easy to find Puff Bar in various stores all around the country. They said they had ceased distribution a while back. It is unclear whether they actually have or if there are a variety of knockoffs. Both JUUL and Puff Bar are brands that have been, well, like a lot of products manufactured in China, there are counterfeits made right alongside the real products, and they come over here, and there are plenty of online retailers that don't really care whether or not they're allowed to sell those products. The way that the FDA addresses pre-market review is to deal with the manufacturers and not really deal with retailers. And so if they can established that Puff Bar is distributing its products illegally, they can punish Puff Bar, but the FDA has not historically really done much, if anything at all, when it finds products in retail stores that are not supposed to be there. And the other unfortunate nuance here is that the FDA is not really doing its retail inspections right now because of the pandemic. And so I would say that if people are seeing Puff Bar and other products that shouldn't be in stores, you should still report them to the FDA. Just, don't expect swift action on that, but the FDA should still be hearing about that so that it can take action based on the evidence that's out there.
Thank you. The next question, I believe, came through when Mark was speaking, and I believe you touched on this slightly, but if you have anything else to add, or if you just want to reiterate what you said, in North Dakota, our biggest challenge is our low tobacco tax. What advice does the Public Health Law Center have for North Dakota going into our legislative session on cigarette and e-cig tax structure?
Ooh, I think it's a great question. I bet Heather has some thoughts as well. I mean, I can certainly start out. I think that this is probably a unique opportunity. Sort of the bad issues have all kind of combined to make this a chance, I think, where there might not have been otherwise for an increase in tobacco tax. And I guess I would say, kind of speaking to legislators in their own language, I think there's going to be probably a significant budget gap if North Dakota is like most other states. I think the COVID, the pandemic has seen to that. So I think that's going to be part of it. I think you can look at, there's so much literature, there's so much research on showing what the positive economic effects are of increasing tobacco taxes in terms of healthcare spending. I think it's not a close call at all. I think if you can get that information in front of people, it's so compelling. And it's so difficult to disregard. I think that's very important. I also think the idea of decreasing in use, especially when we've seen e-cigarette use among youth go up so exponentially. That is one way we know kids are very price sensitive. We know that finding some way to make that economic barrier to entry higher is going to ultimately benefit the kids. In the state. I had another idea. And then I think the last one was that I would hope, and maybe this is less influential in North Dakota than it would be in other states, but I do think often states feel like they don't want to be left entirely behind. And so seeing that the tax rate is now 48th, at least for cigarettes in the country, and that a lot of similar states, politically, I think have increased taxes or added taxes on e-cigarettes. Sometimes that can be an argument that is influential with even people who don't generally agree with taxes. The idea of taxes themselves can be repugnant in some cases, but I think sometimes it's the idea of, well, we're behind the rest of the country in this, and we don't want to get too far behind at least our peer states. But I don't know. I mean, I don't know your legislature. I bet Heather has some probably better thoughts than I have.
Did you have anything to add, Heather?
Yeah, I sure would just chime in and agree with everything that Mark is saying. I think that he's correct in some of the data that we can show that does make a really compelling argument. The nature of our legislature is at times difficult, especially for what we're attempting to accomplish. Tax policy runs up against ideology a lot of the time, with us being a much more conservative state and a more conservative legislature. So that being said, I think it is important to note just how far we have fallen. I don't know if you know this, Mark, but we're the 48th now, but when that 44 cents was put in place way back in 1993, we were number 8. So we've gone from the top 10 to the bottom.
I didn't know that in and of itself is really
amazing, right? Yeah. So we were number 8. We did have a claim to fame as being really progressive with our tax policy back in the day. And so that is a point that we are trying to bring back home and bring back around. And then I think it's also important to note, because of some of the philosophy that, sometimes our policymakers have, that are more business focused, even raising the rates at the, prices that we're, suggesting that we raise them, wouldn't outshine our neighboring states. You know, Montana is at $1.70, South Dakota is at $1.53, and Minnesota is at $3.04. And so even if we did, you know, the dollar increase that the standalone, you know, cigarette pack bill would do, that puts us at $1.44. That's still, you know, just behind all of our neighbors, even though we wouldn't get the bottom anymore for the country. And then, you know, the comprehensive bill, that 28% ad valorem rate, you know, the average increase, you know, because, you know, obviously there's higher price brands and lower price brands, but the average would put us at around $1.12. And so again, still a nice big jump to promote, you know, health policy and prevention policy, but not enough to maybe, you know, make our policymakers, you know, uncomfortable with, you know, jumping high above our neighboring states. And so some of the methodology that we are using kind of takes into account, you know, some of what you're talking about, Mark, with, you know, not falling so far behind, but also not racing to the top of the pack to make, you know, that other end of the spectrum uncomfortable too. So hopefully some of it is compelling this go around and makes sense. We're really trying to be, you know, reasonable and common sense and create parity and let our legislators know that this is just so long overdue that you have to start somewhere, and where we're proposing to start makes sense, and it will save a lot of people, you know, detrimental health issues and, you know, potentially their lives, and it will also save our state a lot of money and resources while generating extra income that can be used to fill some of the gaps that we foresee coming. Great question.
Thank you. I know we're going over time just a little bit, but there are just, I think, a couple more questions in there. So if our speakers are game, I'll keep going unless anybody has a prior commitment they need to attend to. The next question, I'd probably direct this at the Public Health Law Center. Are there any existing regulations in the United States regarding in-shop compounding of e-liquids?
I will say at the federal level, the answer is no, sort of. There's nothing that would restrict retailers from mixing liquids in stores, except for the fact that if you are mixing liquids, you are actually creating, you're a manufacturer under federal standards, and so as a manufacturer, there are a lot of requirements that go with that, including registering with the FDA. And you are responsible for the pre-market review process for all your products. So if you, for example, have a vape shop that has, you know, 20 different flavor varieties that it can mix into, you know, 300 different variations, and each of those can come in 3 different nicotine concentrations, you should have filed pre-market review paperwork for over 900 products last month. And so it's pretty safe assumption that almost every vape shop in the country did not do anything even related to that. So if you have vape shops in your community that are still mixing chemicals in store, I'd report that to the FDA. Again, you know, FDA enforcement is not quick and not necessarily effective, but once we get going on the pre-market review process in the next year, there should be actual enforcement of that. And once retail inspections resume, hopefully that also will help that problem as well. I don't know, I defer to Mark on whether there's anything in that realm in the state or local level. I know there are a handful of places that have tried to do things in that space, but I don't know about regulating the actual mixing liquids.
No, I don't think so. I think we've seen caps on nicotine levels in a couple of places. I think probably what you might run into is that you know, sort of this weird space where this is technically not allowed under current FDA, you know, under the law, under the Tobacco Control Act, mixing on site, but also it's not really, it might be preempted as a manufacturing standard for state and locals to do it also. So, but they couldn't really make that argument so much because then it'd be like very obvious that they've been violating federal law too. But I don't think anybody has gone into that. I've not seen that yet. Anyway, that's a long answer to didn't need to be quite so long. Sorry.
Thank you. Just one last question here, and then we'll wrap this up. Were internet sales ever addressed by the FDA or federally?
No, they haven't. The FDA treats online retailers just like brick and mortar retailers, so you are technically still required to comply with minimum legal sales age and to check identification of buyers, but there is nothing unique to online sales. The Tobacco Control Act actually requires the FDA to do something with what it calls non-face-to-face sales, which would include internet sales and mail order. But the FDA has never taken any steps in that direction. There is a federal law called the PACT Act that actually that prohibits cigarettes and smokeless tobacco from being shipped in the mail, and there's regulations on common carriers. So it's very difficult, if not impossible, to buy combustible tobacco products over the internet, or I should say cigarettes, not necessarily cigars. But there's no federal regulation on the internet sale of e-cigarettes at this time. It's well within the FDA's authority. They just haven't done it.
Very good.
A lot of
Well,
state locals
thank
have
you
done
again.
that. Oh, sorry.
Go ahead, Mark.
Quite a few state and local governments have prohibited the sale of internet sales, but enforcement is spotty at best.
Thank you. Thank you all for going a little bit long today. We really appreciate the extra time. Great questions for our great speakers today. As we do close up the session, I would like to remind you to use the link provided in the chat to complete your evaluation and request your continuing education credits. That link closes at the end of business today, so don't wait to do that. Get right on that. I would also like to extend the appreciation of the Department of Health Tobacco Prevention staff for taking time out of your busy schedule to attend one or more of these sessions presented during the 2020 End Summit series. We do sincerely hope that you are able to incorporate this education into your tobacco-related endeavors. Thank you. Stay safe. Happy holidays.
Thanks, everyone. Thanks, Abby.
Yes, thank you.